Hello and welcome to our webinar series, Surviving COVID-19. I am your host, Rekeema Turnbull. If you can hear me, please go ahead and give us that signal in the chat so that we can know you can hear us very well. If you see my lips moving, it means that you cannot hear me. So hopefully you will sign out and sign right back in. Surviving COVID-19 is a webinar series that is geared to bring in informative and insightful information to you that can help us all get through COVID-19. COVID-19, as we can all agree, has presented unprecedented times. None of us have the answers, and leaders around the world are required to make decisions on a daily or better yet hourly basis. One thing for certain is that you are not alone. I am not alone, but we are in this together. Today's session, Safeguarding Your Mind, is especially for all of us. Our presenter, Dr. June Samuel, is ready to give us some tips on how we all can safeguard our mind. But before we begin, let's jump right into a bit of housekeeping tips. Your audio will remain on mute and your video turned off throughout the presentation. Questions will be accepted at the end of the presentation. To ask any questions, you will raise your hand virtually to be acknowledged, or you may use the chat option. This presentation, like all the others, will be available afterwards via our YouTube page. HireBVI. A bit about HireBVI. We were founded in 2015. We are a locally owned and operated company, and our services include human resources and business solutions, recruitment services, human resources consultancy, payroll services, career expositions, training programs, document processing, as well as work permits. And we also have a job advertisement board where you can advertise your job vacancies, and these ads are also accepted by the Labor Department.
So you're saying I can ask this cat any question?
The cat is connected to the computer. You just type in the question, it will read his mind. There the answer comes.
You're the man! I've been looking for this for weeks.
About your host. I'm dedicated to seeing individuals, teams, and organizations succeed. I have over 15 years of combined experience in various industries. My educational background includes a Master of Business Admin and Global Management, a Bachelor of Arts in Accounting, L7 Diploma in Strategic Management and Leadership, a Six Sigma Green Belt certification, as well as I'm also a certified business continuity manager. Currently, I serve as a managing director of HireBVI, and I'm also the finance, HR, and admin manager of CCT. A special thank you to 5 Doctors Medical and Wellness Center, a mind-body center, meeting your counseling and wellness needs. They have experienced specialists who are offering mind-body approaches to health conditions, assessment and treatment of a wide range of mental health conditions, including depression, anxiety, PTSD, and phobias, treatment of substance abuse disorders, psychological evaluations, stress management interventions, court evaluations for capacity and other legal concerns, life coaching and training for workplaces, employee assistance services for workplaces. They also offer training, motivational meetings, and organizational assessments for workplaces. 5 Doctors Medical and Wellness Center also offer these services regionally on a consultation basis. You can stay in contact with them at 284-345-1591 or 340-1275 or you can email them 5doctors with the number 5@gmail.com. About our presenter today, Dr. June Samuel is a trained psychiatrist with a Doctor of Medicine degree in psychiatry. She's dedicated to community psychiatrists with extensive experience in public and private inpatient and outpatient settings, and an experienced psychiatric administrator who continues active clinical practice at the Dr. D. Orlando Smith Hospital in the BVI. In October 1992, she completed her Bachelor of Medicine and Surgery degree. After a 2-year internship, she returned to the BVI to work in 1994. Dr. Samuel is recognized as the first psychiatrist and director of mental health services to serve at the Health Services Authority, and until recently also served as Chief of Medical Staff, Director of Medical Services. She's the director of 5 Doctors Medical Services, which seeks to actively develop the practice of mind-body medicine in the BVI and regionally. Her true passion remains helping individuals to understand themselves and their role in the world around them. Dr. Samuel is a mother to an 11-year-old Ronnie Allen, who has kept her straight in her perspective on life. I now present to you Dr. June Samuel.
Thank you, Rekeema. You can hear me, right?
Yes, I can hear you.
Excellent. So good afternoon, everyone. It's a beautiful afternoon in BVI here. And the first thing I want to do is I want to express my my gratitude to Rekeema for allowing me to have this opportunity here to speak to you guys about all of the effects of coronavirus and living with coronavirus. Thank you very much for this opportunity to speak to all of you who are listening today. And I hope that by the end of this presentation, we will recognize the immense opportunities that are coming out of this crisis. Crisis always presents opportunities. Once we enhance our minds, we're better able to embrace this whole situation that we're facing now, which is really about living with the coronavirus. So the first slide, we're basically living in unprecedented times. And, you know, it's a historical moment that we're all experiencing here. It is, you know, there are challenges that are going to be presented. It provides an opportunity for change here. And we have to be actively aware of these times in which we're living, because if we embrace what is happening in a very conscious way, then we can embrace the challenges and be involved in all of the opportunities that present themselves for change. And by doing that, we then experience power over our lives, because the power that we want, you know, there's this saying out of the Buddha industry, the Buddha belief system, where on the next slide it says, when you can't control what is happening, when you can't control what's happening, challenge yourself to control the way you respond to what's happening. Because at the end of the day, that is where your true power is. And that is, you know, this situation is a test, it's going to be a test of our power, right? And so in this presentation today, one of the things I want us to understand is that perspective matters. So how we view the whole situation is important. we have to understand that, there is some changes in how we see the situation that will have to change. We have to address our mental and our physical wellness equally, and we must be more ready to live mentally well in this time that is a challenging time. And so what is happening now that has brought us to this place? Essentially, we're seeing the unfolding of a pandemic. And with a pandemic, it's creating a high level of stress. It requires that we have significant changes in our behaviors. But if we adjust to those changes well, then we can become more mentally resilient, okay? And so that is why we're here today, because, normally we have to live on a day-to-day basis. We experience stress on a day-to-day basis, but, this particular situation has some specifics about it that is creating a more widespread feeling of stress. So a pandemic is really a historical event in the world. There's none of us who are old enough to have experienced a pandemic. The last significant pandemic was the Spanish flu in 1918, and that killed 50 to 100 million people worldwide. We also have currently, we live with HIV still. HIV has killed 75 million people worldwide, and we still don't have a vaccine for that. We've had other outbreaks, even in my lifetime. Pandemics happen maybe every 100 years, but we also have other infectious diseases where we have outbreaks. So you have measles outbreak in the US recently, and that really has come about because of our resistance to vaccines. But the thing about pandemics is that survival in all of the events that I've mentioned above, survival occurs. As human beings, we're resilient, and the chances of the whole population being wiped out by a pandemic is pretty slim. So we will be living with and living in a pandemic. And that creates, because it's such a new situation, it creates for us some stress. Why? Essentially because it's a new event for many of us. So if we look back at just as recently as 3 years ago, we had Irma and Maria. That was a new event for many of us. Many of us haven't lived through a Category 4 hurricane, and nobody had experienced a Category 5 hurricane. We didn't know what was going to happen. With this pandemic, there are many unknowns. Because it's a new virus, we don't know, are we going to have a vaccine? We don't know when. There are many, we're now getting new information every day. Even today, there's some information being shared about the new clinical management that is being suggested for persons who get the coronavirus disease. So there are many unknowns. And when we have a situation where there's so many unknowns, and it is a situation that threatens our well-being and existence, because if we get the virus, if we're at risk, we could die, and there's no cure, then that will create a certain level of stress within the population. And the other thing about this situation that creates the stress for us is because we're being asked to make some changes, right? Because of all of the different issues associated with this particular virus in terms of the way it is spread, and some of the other things that are unknown, we've been asked to make a lot of changes in our behaviors. So when you look at these changes that we're being asked to make, then we have to behave differently than we know usually, right? We have to think about our habits and our customs and what those activities do for us. Because normally, if you look at the screen, the things we're being asked, no hugging and kissing. How do we greet people? We have to wear masks in our vehicles. Here in the BVI, we give people People may be hitchhiking and we give them a ride. Now you have to second guess that, because if they get into the vehicle, they need to have on a mask. We need to stand 6 feet or more apart from each other. How does that make us feel? It is affecting church, how we gather at home, family get-togethers. We have to work from home. We have to have school now from home, right? So all of these shifts and changes that we're having to adopt create for us a significant, level of stress. Because if you think about a habit that you've had and you think about what these events do for us, they create oneness, they create a sense of community, and we're having to change that. So those changes create, anxiety. And if we are unable to figure out exactly how to make those changes, then we will feel stressed. And so we have to understand that the biggest lesson from this situation is that this can happen to us. This can happen to any one of us. Any one of us may be affected by the virus and the complications thereof in terms of our lives. And we have to remember that we're going to be living with this virus for a long time, right? So when you think about all of these things, how does these changes make you feel? That's a question I want you to answer for me. I want you to think about, what do you feel right now when you think of all of these changes that you have to make? Are you having any of these feelings you see on the screen? Anger, sadness, irritability, fear, anxiety, longing for normal. I think that some of what we see in terms of when we ask persons to change certain things about what we do on a day-to-day basis, some of the resistance that we see is because we want things to go back to being normal. So wearing a mask, in a crowded place, that goes against our normal cultural behaviors. So there's a part of us that want things to go back to being normal, and having to deal with the fact that there may not be a normal to go back to will give us some one of these feelings. So I want you to name the feeling that you're feeling, and write it down, because that is part of how we're going to safeguard our minds. We have to acknowledge what we really feel about the situation. And those feelings come about when our brains have a way of we responding to what's going on in the environment. So based on what we see in our environment, our brains trigger the amygdala, which you see on the screen, the little pink area. That's a small body in the brain. And that is like your little, that's an area that processes our emotions. So that picks that up first. It interprets what we're seeing in the environment. So we're hearing about the coronavirus, we're seeing all the images associated with it. We have emotional responses to that. That's facilitated by the amygdala. And then the amygdala sends a signal to the hypothalamus, which is there's a blue part of the brain, right? The small green part of the brain that you see on your screen there. And the hypothalamus in the yellow area, it's like the CPU for your brain, right? So just think about your computer that has a CPU that processes and sends out information. The hypothalamus then triggers a whole series of events that will then create what we know as the stress response. And what happens is that we feel those responses physically. So on the next screen, you can see all of the different aspects of your body that gets triggered once the stress response gets triggered. And every system in your body is affected. Your nervous system, your heart rate increases, you breathe in, we're not breathing well, your breathing quickens, your muscles get tense, you get tension, headaches, your endocrine system gets triggered, so you get cortisol that goes into the rest of the body because your cortisol is preparing you to fight, but it also causes you to engage in some other behaviors, which we'll talk about a little bit later. And in your stomach, your gastrointestinal system, you get feelings of upset stomach, butterflies in your stomach, not tolerating food very well, right? And overall, what that does on your next screen is that it essentially prepares you to either stay and fight the threat, which in this case is the coronavirus, or run away from it, right? So in our instance here, we can't really run away from the coronavirus and it living in our community. We have to stay and fight. Now, the challenge about this is that the brain does not really discriminate the threat that you feel. It sees all threats as threats, so it doesn't say whether, okay, this is a threat that is good. So the same response will happen if you're doing a test as if you're running away from someone who is threatening your life, right? So that stress response is a consistent response to threats that may happen. And the stress response affects all different aspects of our functioning. So it affects our body in terms of some of the symptoms we just talked about. It affects our mind in terms of, on the next slide you see, we get worrying, we're not thinking clearly, we get impaired judgment, nightmares. It affects our behavior, so we get into more accidents, we have loss of appetite, we drink more alcohol, some people cope with alcohol. Not sleeping is a common complaint when we're in these kinds of situations. And it affects our emotions. So we're irritable, we feel sad, and that sadness lasts for longer than it should. We feel afraid. Sometimes we withdraw from persons because interactions can make us so irritable. And in our bodies, we feel all of these aches and pains. We feel tired, our skin will break out. So the stress response can trigger all of these different responses in our bodies. And if we're not aware that that is what's happening, then we can easily feel overwhelmed. And the way we respond to the situation then can be inappropriate. And so one of the first things that we're gonna do, so I just give you a lot of information, and I'm probably making you feel more stressed just by telling you all of that stuff. And so one of the things I want you to do right now is to take a deep breath. So take a deep breath, and while you're breathing, focus on the breath going in and out of your lungs. So breathe again, because that is one of the simplest ways that you can actually control that level of stress that you feel by controlling your breathing. So you take a deep breath in and breathe out. Okay, and we're on to the next slide, right? So what do we do to safeguard our minds given all of these things that's going on around us, right? So step one, I have, I think, 5 steps for you. Step one is acceptance. So one of the things that I've been stressing for individuals that I speak to is that we need to accept that what is now is what it is. This is a new normal. People don't like to hear that term because I think for some people it evokes a sense of distress, right? But the reason that I stress that it's a new normal is because the coronavirus is going to live with us, and it is going to be a part of our lives for the foreseeable future. We are hoping we get a vaccine, and we're hoping that we discover some sort of treatment. But if you think about HIV/AIDS, for HIV/AIDS, we have no vaccine. We have a treatment that helps persons to live with the disease, okay? So we have to understand that this may be what we have to live with for the foreseeable future. We have to start looking at our lives and what we may need to adjust in order for us to feel less overwhelmed by what we're presented with. Mastering ourselves is where the true power lies, right? And we all can master ourselves. We can all master our lives. You know, everybody in this situation, I saw somebody said recently, we're in the same storm, but we're all in different boats, and that is true. But the truth is that once you're here, we have to work on finding the solutions to whatever each individual situation is. But this first step is acceptance. This is what it is. The virus is going to be here. Our lives are going to continue to be very different for the foreseeable future. So let's just start, you know, adjusting ourselves and our lives to that. The second step. So the second step to safeguard your mind against all that's going on, and bearing in mind what I said on the first slide, right? If the virus is going to continue to be with us, it means that there's going to be new information all the time. And there is new, as a medical practitioner, we have to keep up with the new information. But you can avoid overexposure to the information. The people who are overnight experts, avoid them, right? So people who are expounding all sorts of theories about what is and isn't, you know, those are not useful for us to listen to, especially given the fact that a lot of what we are expounding about, we may not even know, okay? Because as I said, it's a new virus, so there's new discoveries being made all the time. Stick to reputable sites. Get a source, one or two sources of reputable information. WHO, CAFA deals with the Caribbean situation. Pan American Health Organization deals with the Caribbean situation. Those might be the sites that you might want to stick with, so that whatever, they're very current, any research that is happening is on these sites. So, you know, you want to stick with two sites that are reputable, that you go and look for information if you need information. We need to stay tuned to all local information, right? And we know how to get that. The government has a site where they circulate what is current for our BVI situation. Social media can be an enemy if it is not managed, and I want to warn you about that. And I put masks here to remind me, because, you know, wearing masks is something that we will have to continue to do. Again, because the virus is going to live with us, and until we can figure out how to manage the virus from a medical perspective, wearing masks in public where there are lots of people has been shown to be helpful. But there was recently a video going around on social media that talked about how to wear a mask, and the information in the video was quite inaccurate. So we have to be careful about what we see on social media and how we use that information and manage that, okay? Step three is connecting to others. Very important for us as human beings. We are social creatures, and, you know, in the Caribbean, in the Virgin Islands, you know, connection to family and friends is important. So we want to, you know, in a era now where we're being told to, you know, physically distance ourselves from other persons, you have to find a way to create that connection using the platforms that are acceptable, right? And I've listed some of those there. So we can FaceTime, video chat, Zoom. TikTok is the new one that's being used a lot by younger persons for making videos. But the most important thing is to connect regularly. So who's your social support? And try to connect with your social support on a regular basis. And, you know, you have to also be aware of where you may be feeling as if you don't want to connect with persons, because that may be an indication that you're not coping well. But the physical distancing does not mean that we should isolate ourselves from our friends and our families, and that connection is important in safeguarding our minds, okay? And then when I talk about knowing what your value is. So this is the value that drives me, right? So let us love one another. And if that's the value that drives you, then for this particular virus, it provides an opportunity for us to demonstrate that value. And that would be something that's important as we go along. So if love is important, then everything that I do in terms of my own behavior and taking responsibility for my health will be because I love myself, it'll be because I love my family, and it'll be because I love my friends, right? So if I'm supposed to wear a mask, I'm going to wear a mask when it's appropriate, right? If I'm supposed to wash my hands, I'm going to wash my hands as the instruction is given when it's appropriate, because by doing that, I demonstrate love for myself and everybody else. So each of us has to figure out what's our value and how that value is going to help us to behave, help us with the behavior change that we need within this particular situation. Then step four is to take care of your body. So we're talking about safeguarding your mind, and you may ask, well, what does your body have to do with it? And we know in medicine that there's a significant connection between our minds and our bodies. We have to eat healthy. We have to be very careful now, particularly in this time, of what we're eating, what we're putting into our bodies, because one of the ways that we can fight this virus is through our immune system being resilient. But our immune systems can only be resilient if we are taking care of that part of our body. So, making sure we're having healthy, balanced meals, exercise, and exercising regularly is important because, the studies are out there. It shows that once you exercise, exercise has a way of it's actually the antidote to the stress response in a positive way. So it helps to decrease and reverse some of the responses that you get when you're stressed. Avoiding substances, okay? So any substances or things that we're putting into our bodies that have no useful purpose, now would be the time to avoid, because we don't know, if it's not helping, it may be hurting. So alcohol, excessive alcohol use, tobacco, smoking, other drugs, right? So, being mindful of what we're putting into our bodies and taking care of our bodies in a way that helps to build our immune system is important, okay? And then step 5 is taking care of your mind. So what does that look like? Earlier, I told you about taking a breath. I don't know how many of you decided to take a breath, but breath control and managing your breathing is a significant part of managing the stress response, right? So when we're under stress, one of the things that we do is that we take breaths that are shallow. So we don't breathe deeply. And because we don't breathe deeply, we don't take in enough oxygen to help the brain to function and basically for us overall to be healthy. So just consciously, several times a day, take some breaths. Just stop and take deep breaths. You can take 2 breaths a day, but the point is to do it intentionally, right? And make that a regular part of your practice. Controlling our thoughts. Where are your thoughts right now? So I'm talking to you about managing your mind, taking care of your mind, about coronavirus. Are your thoughts here? Are we worried about all the other things? Like, so for example, I can share with you that, electricity went off in my area, which interrupted my child's homeschooling. So that becomes, a concern in the back of my mind. And that is what happens. We have a lot of different thoughts going through our minds. And if we're not conscious of how our thoughts may be all over the place, it makes us feel overwhelmed, and it contributes to that feeling of anxiety. Meditation. Now, meditation has been shown through research to be the one practice. If we do it every day, 20 minutes a day, it helps to reverse and control that level, that stress response that I talked about earlier. And there are many other benefits from meditation in terms of how it can improve your focus, it can improve your concentration, it can help in terms of managing your thoughts, it can help in terms of managing your breathing. So if you've never tried it, there are apps that can take you through a meditation practice. We can teach you how to do that. But it is one of the recommendations in terms of mind-body medicine that has been shown through research to have a definitive positive effect on the stress response in terms of management of that response. Prayer, a lot of us are familiar with prayer. Prayer and prayer practice and actually, living by the prayer. Because sometimes, we pray and then what we pray for, we get to we take it with us. So actually praying and engaging that whole ritual has also been shown. It has been studied and it has been shown people who have a belief system that they practice on a regular basis is one of the things that can help with safeguarding our mind when we're going through crises such as the one that we are now. Sleep for me is always a whole long discussion because in my experience clinically, most persons don't get enough good quality sleep. And as simple as it may sound, sleep is important because during sleep, which is a physiological process, your body heals, your body rejuvenates, cells and tissue that have been destroyed during the day actually repair them. The body repairs itself during sleep. So if it is that you are having challenges sleeping, and that can happen again because the situation we're in is so anxiety provoking, then that is something that you need to get some advice on. And then the last thing I have on there is structure and discipline. Because this particular environment that we're living in requires that we have structure that we stick to and discipline to stick to the structure that we set. Working from home, schooling from home is, for me, it is great, but it brings with it other types of challenges, which if those challenges are not managed well, can actually create more stress for you. And the two things that are important are the structure, so setting schedules, getting lists, setting your goals, and making sure that you stick with that is very important. And it's going to be important for children who are homeschooling. Maintaining that structure is extremely important. If it's the only thing that you do, it will make a big difference in terms of how well it gets done. And then, of course, being disciplined to enact all the steps we talked about before. It takes a certain level of discipline to do all of those things. And then if all else fails, so, you're doing all of these things, you're managing, but you find that the distress or the anxiety of dealing with your current situation impacts the activities of your daily living. So, you're unable, you get to the place where even though you're trying all of these things, you find that you're not able to manage, you're not able to focus and concentrate, then you need to seek help. And the things that you would be looking for that would tell you that you need to get some help would include symptoms such as feelings of ongoing anxiety or fear. Okay, and I would have to say to you that I've been seeing quite a bit of this. Persons are very fearful. We're very anxious because we're not sure what's going to happen next. It seems like every day there's something new in the news. There's some change, and that can be challenging to manage because it just seems like so many things are changing quickly. right? Changes in appetite, energy, or activity levels. So, you don't feel motivated to get up and go. Okay, maintaining physical distancing can push you into a place where, having that drive to do what you need to do is not there. Difficulty concentrating. So you're working from home, but you're having difficulties completing your tasks, completing your work. Difficulty sleeping. Okay, and nightmares with upsetting images, physical reactions such as ongoing headaches, stomach problems, so much so that it's difficult to maintain your appetite, okay? And if you have chronic health problems, so if you have diabetes or hypertension, those all of a sudden seem to not be controlled. You're taking your meds, but they seem to not be controlled. Irritability, being short-tempered, and just having a sense of being uneasy, okay? And, if you were a social drinker, drinking more than usual. If you're using marijuana once or twice a week, using marijuana every single day. If you're smoking 2 cigarettes a day, up to 20 a day. These are all signs of distress, and they're signs that you need to probably reach out and get professional help, okay? And the other thing is I want us to, so you look out for those, but I want us to not forget the kids. So children are around us. Many of us are parents, and sometimes as we are trying to cope on a day-to-day basis, we forget that children are actually feeding off of our energy. They're actually reacting to what they see around them. So I want to remind those of us who are parents to have direct conversations with their children about what they're seeing and what they're hearing. It was interesting to me with my son. He, after the lockdown was eased a bit and we could go into town, I kind of reached out and said, let's go into town. And he didn't want to go. We had a conversation about it. And essentially he was afraid. He was afraid that if he left the house, it's almost as if the virus is right outside and he could be affected. And you'd be surprised what ideas children may have in their head about what is going on, because they're seeing, they're hearing, and they're absorbing what's happening. So talk to them, and if you have difficulties talking with them, have someone talk to them. Because they also are going to be having feelings that they don't know what to do with, and they will need their own types of intervention to help them to cope. And so we're going to stop. So if you're in any situation that you're feeling overwhelmed, just stop. Stop whatever you're doing. Take a few breaths. Observe what is happening around you, what you're feeling, what's going on around you, and then you proceed to do what needs to be done. And this is a nice acronym. You can print it off, stick it up. Anytime you're feeling, it's called a mindful pause. When you're in a situation where you feel overwhelmed, as if too much is coming at you, you simply stop. Take some breaths. Notice what you're feeling. Notice what is happening. And then you move forward to do what you need to do. And every day, an affirmation that is positive, have positive affirmations, okay? I have a positivity pledge. Take the positivity pledge, right? Don't allow negative thoughts or feelings to drain you of your energy. Focus on all the good that is in your life. Because in spite of all that's going on, we have a lot of good still around us, okay? And think it, feel it, speak it. Send positive energy into the world. Be grateful for the wonderful things in your life. Look for the things that are positive, and you will attract more of the same. And if we take those simple steps and do them every single day, it will help us to maintain mental resilience through this situation that is likely to be continuing for the foreseeable future. Thank you. So we can take some questions now, if there's time. Thank you for that.
Thank you so much for that, Dr. Samuel. That was quite informative. I did enjoy it. It was a lot of information, but it was very easy to understand, and I did enjoy that about it. I am extremely grateful for you. I'm sure that many on the line are also grateful for that information as well. If there's anyone that has any question at this time, you are encouraged to go ahead and ask your question. You can raise your hand and we will acknowledge you, or you can put a question in the chat. That can also work as well. So is there anyone on the call at this time that would like to ask any questions to Dr. Samuel?
Yes, hi. Hello, this is Lena Verdelli from New York. Thank you so much for your excellent talk. A question, what are your thoughts about persons who have a history of mental health problems and they are higher risk group? How can they protect themselves better? Thank you.
Thank you for that. Thank you for that, Lena. So persons who, who have been previously diagnosed. So if you know that you have been diagnosed with, like a mental health disorder, anxiety, depression, you would want to, one, ensure that you are connecting, staying connected with your support system. Here in the BVI, we have persons who have been reaching out. So having access to, ensuring that you have, if you're doing therapies, having regular sessions, or, just staying connected, because I think the whole thing of the physical distancing, social distancing, places those persons more at risk. So it's important for you to ensure that you are reaching out, paying attention to your symptoms. If you notice that any of your symptoms, are starting to increase, that you get attention for that. But staying connected with your support system would be really important. Along with some of the other things that I mentioned in terms of, just the general self-care, and putting into practice some of the steps that I outlined before.
Thank you. Very helpful.
My question is, I know that the slide came up specifying the symptoms that you may have experienced during the lockdown or during this situation with COVID-19. But my question is, when those symptoms have subsided and we are now going back out into the real world, should we see a professional even though those symptoms have subsided, or should we just monitor them and do as the steps say, step 1, step 2, step 3, and step 4? Or should we seek a professional to evaluate or how to say mental health?
Right. So what I would say is that, professional help is recommended if the symptoms are continuing to escalate. And really it's about if they're interfering with your ability to function on a day-to-day basis. Because bear in mind that, persons may have various types of symptoms, anxieties, not sleeping, etc., and put various supports in place. And sometimes just by talking with someone, reaching out to somebody, getting in touch with family, sometimes just putting those what may seem like simple measures in place will help to address some of the feelings, right? Whatever it may have been causing the anxiety for different persons, specific issues that they may be having that is causing the anxiety. If that gets addressed, the anxiety goes away. So really professional help is really recommended if you get to the place where it's affecting your ability to function on a day-to-day basis. So you'd want to monitor and then seek help if you find that the symptoms are not going away.
Okay, thank you.
Thank you very much. I thank you so much for this opportunity this afternoon, Dr. Samuel and HireBVI. Thank you so much for getting this together and getting this done. It's so very needed. I just feel I'm just very sorry that there are only 18 participants on the line. My question is that in the Caribbean, there tends to be very little emphasis or attention that is placed to mental health. Generally, there's a stigma that's always attached to it once you even mention the word mental and health, and that's usually negative. With physical issues, the problems are very clear and quickly, you have to very quickly, and you can very quickly identify when something needs to be done and attention needs to be paid. A hand is hurting, a finger is hurting, but with mental health, those signs and signals are sometimes ones that they're glossed over by the individual, and they're not paid attention to with the urgency with which it needs to happen. How do we as a population make mental health a conversation that we need to be having at all times within a scenario such as this, and even at times, but I think especially at times when all is well, and we should be doing that for ourselves on a day-to-day basis.
Thank you, Sally. That's a really comprehensive question, and it is something that as mental health professionals, we try to address and have to deal with on a daily basis. And I think, that's why I was so appreciative to Rekeema for providing this opportunity for this, because as a matter of fact, one of the things that we're seeing and we're talking about more in the field as a result of one of the fallouts from this whole COVID crisis the fallout is going to be in mental health, because again of so many changes that persons are required to make and the challenges that people are going to be having with making those changes, and of course healthcare workers and having to deal with that. So there's a fallout for mental health that has been recognized as the next set of challenges we're going to deal with. I think the way around it continues to be education, continues to be about reaching people where they're at. In the BVI, we are doing a program, continuing to do a program on mental health and psychosocial support, which basically exposes the general population to the type of support, psychosocial support that they need, that most people need, everybody needs that type of psychosocial support, which is about education, just being able to talk about what you're feeling. And you don't necessarily have to be a mental health professional to deliver that. So we've been having training to make more persons aware and to equip more persons in different fields with that type of skill. So people are comfortable just responding. So even in workplaces, for example, if you have an employee who says, I'm really not coping, I'm just feeling overwhelmed, having the facility for that person to be able to talk about it and normalizing that it's okay to talk about what you feel. So we have to get it into all the different spaces where we work, where we worship, where we live, and just continue to have those conversations. We may not necessarily refer to it as mental health, but definitely psychosocial support for everybody so that persons know where they can get the help when they do need it. And that can be, it doesn't have to be a mental health professional in that sense of the word. It can be persons who know how to deliver the type of intervention that persons need when they're in distress. So that's an ongoing type of project, and throughout the Caribbean, I know it is something that we're continuing to work on, and hopefully over time, we can see it become more and more of our conversations every day.
Thank you.
Dr. Samuel, this is Dr. Cayetano Claudina. First of all, my congratulations to you. I'm very pleased and proud of you by doing this. As the previous caller mentioned, the issue of stigma in our communities in the Caribbean is quite high, but the work that you're doing is, having people connected. This is very important. Normally, if we have if you call on a meeting, sometimes face-to-face, you have even less people than what we have now virtually. So even this number, we have people that matters to listen to you and to be able to take that information and then really start to make mental health matters, because mental health is everybody's business. So one of the questions that I wanted for you to perhaps to consider this was so relevant. What would happen if someone who, because of the lockdown, they will never experience mental health problem, but they continue experiencing mental health problem? The stigma again is the same there. Is there I know they mentioned the call in and the number to call. Is there a way for them, if they require treatment with the restrictions? How does that work in the country right now?
Thank you, Dr. Cayetano. So we have teams that are out there that are able to go out and do crisis response if persons need to be seen. They can get seen at home or wherever they may be presenting. So, and that would be in the situation where we're unable, like if you have a situation where you recognize that somebody is not doing well, but they're unwilling to come. So we have a team that we can activate that would actually come and do an assessment and talk with the person and try to get them into a space where they can be helped. Or we tend to do a lot of our treatment in community. So during this phase, we've been keeping as many of persons who need treatment as possible. We've been treating them in the community so that we don't necessarily hospitalize persons. The other thing is we do have numbers. So there are a number of hotlines that persons can call. My number up there is one, but those numbers have been circulated. The government information cell that has all of the relevant numbers, their crisis calls, crisis numbers, crisis hotline numbers there that persons can call. And on those phones, we have persons who have actually been trained in psychological first aid and can provide psychosocial support. So you may not necessarily need to talk to a mental health professional, but they can, talk with you about whatever it is you're experiencing and provide the relevant education and advice. And sometimes that's all that's needed. But if we need more intervention, then that's available with our crisis teams as well.
Good afternoon. Very enlightening presentation. What I would like to know is, do you have your mental health, your healthcare workers isolated, and what service do you, if any, offer them? I mean, and are they put up away from home so that they can provide service without the fear of infecting their families should they become infected themselves?
So in the BVI, we have a whole program for healthcare workers who are dealing with who may be working with COVID cases. And the direct answer to that is no. But the full answer is we provide intervention support for our healthcare workers who are on the front line. And if the healthcare workers feel as if they would not want to return home, we have facilities arrangements in place whereby they can go to a different location. But we don't require them. The only time we require healthcare workers to be isolated would be if there's a risk that they've been exposed, right? Which is a standard kind of approach for, in the community. So if there is that risk that they have been exposed and it's a significant risk, then they go through the same protocol as other persons. So there's a whole process in place for supporting our frontline healthcare workers, and that is ongoing because, the healthcare workers it's not just about the fear of being exposed, but it's about the fear of having to provide the service and what it means as a healthcare worker on the front line, okay? There's a lot of anxiety that can be associated with that. So we provide ongoing psychosocial support for them that they can tap into either individually or as groups to help them to be able to cope with this situation, recognizing that this is going to be an ongoing situation for the foreseeable future, right?
At this time, I'll encourage you to download our HireBVI app. It is in your app store, whether it be your Apple Store or your Google Play Store. Our app is available to you, so you can download your app and keep connected with HireBVI. Thank you so much, Dr. June. At this time, we'll conclude. I don't see any other hands that are raised. Thank you all so much for tuning in today's session, Safeguarding Our Minds. This is your Surviving COVID-19 series. I am your host, Rekeema Turnbull. Your presenter was Dr. June Samuel. We encourage you guys to go ahead and take a deep breath and remember those 5 steps. Again, until next time, stay safe and remember, today is Friday. Bye-bye for now.